Long before penicillin changed medicine, doctors and field medics pressed moldy bread into wounds to stop life-threatening infections. This wasn't pure superstition. Healers from medieval Europe to ancient China and even World War I soldiers used damp, moldy poultices and sometimes saw wounds heal when gangrene might otherwise have set in. A surprising fact, everyday mold can produce chemicals that slow or kill bacteria, so those poultices could actually reduce infections. The science is simple. Certain molds release natural antibacterial compounds that make it harder for germs to grow, like a tiny chemical fence around the wound. The problem was consistency. Different molds, different strengths, and dirty dressings meant the treatment could help, do nothing, or even make things worse. Alexander Fleming's accidental observation in 1928 took that messy folk trick and turned it into a reproducible drug when he isolated penicillin, a mold-made compound that reliably killed bacteria. First, we'll look at the historical stories and odd recipes that kept mold poultices in use. Next, we'll explain in plain terms how mold fights germs. And finally, we'll briefly compare that rough medieval cure with how modern antibiotics are purified, measured, and safely used. Stick around to see how trial, chance, and a smelly piece of bread paved the way for life-saving medicine, and why the same basic idea still matters today. Why mold was used on open wounds. When surgeons and families faced a deep cut with no sterile tools, they often reached for the closest thing that seemed to help: moldy bread, cheese rinds, or soft-spoiled curds pressed onto the wound. People noticed that the bad smell faded and that some wounds stopped filling with pus after these poultices were applied. Folk healers across Europe and other regions routinely recommended a damp, fuzzy piece of bread as a dressing for ulcers and animal bites. It was a practical, available remedy passed down by observation. People used this method because it worked sometimes, and they could see the difference. The fuzzy growths on stale foods were visible and easy to gather, and when placed on a sore, the skin around the wound could look less inflamed and drain less. That visible improvement convinced caregivers to keep using moldy poultices even when they did not understand the underlying cause. Soldiers and rural families reported fewer bad odors and, in some cases, faster-looking recovery after treating wounds that way. Mold helped because it is not just harmless fuzz. It makes chemical weapons against bacteria. Simple explanation: molds compete with bacteria for food and space, and to win, some molds release substances that slow or kill bacteria nearby. Those chemicals stopped bacteria from multiplying inside the wound, reducing infection and allowing the body's healing process to get a better start. In plain terms, the mold was a living guard, secreting natural compounds that turned a messy, infected sore into something less dangerous. There was risk, though. Not all molds are helpful. Some produce poisons or cause their own infections, and a poultice could introduce different microbes into the tissue. The results were inconsistent. Sometimes the treatment seemed miraculous, sometimes it made a wound worse. That unpredictability kept medical practice cautious and experimental for centuries. Compared with modern antibiotics, the old method was crude. Today we use purified drugs that target bacteria at known doses and with known safety profiles. Back then, people relied on luck and visual signs. The leap from placing fuzzy bread on a wound to isolating a single, potent chemical was driven by those mixed successes and failures. That uneasy mix of hope and danger. Seeing wounds improve sometimes, but not knowing why or when, pushed caregivers and early scientists to ask whether the helpful effects of some molds could be made reliable, safe, and repeatable. Did mold actually kill infection? During the centuries before purified drugs existed, folk healers and some battlefield medics wrapped cuts and ulcers with pieces of moldy bread, damp cheese, or poultices taken from cellar walls. Reports from different places described the same practice. When other treatments failed, people pressed whatever was at hand into a wound. Sometimes the change was striking. The smell of decay faded and the swelling went down, and that made practitioners believe the mold had driven the infection away. Mold can actually stop bacteria, and the reason is simple. Many molds make chemical weapons to defend their food from bacterial competitors. Some of those chemicals happen to interfere with how bacteria build their outer shells, so the bacteria stop growing and burst. One well-known mold, from the Penicillium family, produces exactly that kind of compound. Observant doctors later noticed that plates of bacteria left near Penicillium suddenly had clear rings where the bacteria couldn't live. That basic observation explains why a moldy poultice sometimes seemed to kill or stall an infection. What people used in the past was unpredictable, though. Not every mold makes helpful chemicals, and the amount of antibiotic the mold produced in a rag or on bread was random. Some molds make poisons or cause their own infections when placed on a wound. Dressing a sore with a moldy shoe could do more harm than good. In other words, the practice worked by chance. When a beneficial mold landed in the right place at the right time, bacteria were suppressed. When it didn't, the patient could get worse. Modern antibiotics are the opposite of that guesswork. Today, we isolate a single active compound, measure exact doses, and know which bacteria it targets. A medieval poultice was a mixed bag. A lab-made drug is precise. That contrast helps explain both the surprising successes of early mold treatments and their frequent failures. The rough experiments of old healers pointed toward a real biological effect, and that curiosity eventually led scientists to extract and study the active agents under controlled conditions. How mold led to the discovery of antibiotics. When wounded soldiers and ordinary people had no access to sterile hospitals, one common remedy was as simple as a scrap of bread or a smear of cheese. Barbers, apothecaries, and folk healers would press moldy bread onto cuts and ulcers, believing the foul-smelling mass helped dry out infections or draw out bad humors. Sometimes the wounds improved. Other times they got worse. That unpredictable success left healers puzzled but curious, because the same visible mold that looked rotten sometimes seemed to stop the spread of pus and redness. Scientists later learned why those odd poultices occasionally helped. Molds are living organisms that compete with bacteria for food and space. To defend themselves, they make chemicals that slow or kill nearby microbes. One of those chemicals, produced by a Penicillium mold, interferes with how bacteria build their outer shell. Without a proper shell, many bacteria cannot keep their contents inside and they burst. That simple action is the heart of how penicillin works, explained in plain terms. The mold makes a poison for bacteria, and when given cleanly and in the right amount, that poison protects patients from deadly infections. The path from smearing mold on a wound to having a reliable medicine required curiosity, stubborn study, and a lot of trial and error. A famous scientist noticed a contaminated culture plate where bacteria stopped growing around a stray mold colony, and he wrote down the observation. He could not, however, turn that observation into a stable treatment on his own. It took other researchers to extract, test, and purify the active substance so it could be given safely and in known doses. That process transformed a hit-or-miss folk practice into a reproducible therapy that doctors could depend on. It is a surprising truth that a chance contamination and careful observation were both essential ingredients in a revolution that saved millions of lives. Comparing those early practices with modern antibiotics highlights how far medicine moved. Medieval or folk applications used whole molds or messy poultices, which meant the amount and type of active chemical varied wildly. Sometimes a poultice had plenty of antibacterial compound and the wound improved. Other times it introduced new germs or toxic substances and made the situation worse. Modern antibiotics, by contrast, are purified molecules produced under controlled conditions, tested for safety and effectiveness, and given in precise doses. Still, another surprising link remains. Many of the first and even some current antibiotics come from fungi or soil microbes, the same natural competition that led people long ago to notice mold's useful behavior. The story of mold and antibiotics is a lesson in paying attention. Early healers noticed patterns in the messiest conditions and tried remedies that occasionally worked. Observant scientists asked why and then learned to isolate and harness the active agents. That combination of hands-on practice and careful laboratory work changed medicine forever. Yet the tale keeps tension. Bacteria adapt, and researchers must keep discovering new solutions, often by returning to nature's crowded battleground where molds and microbes still fight for survival. You might picture a cranky old healer pressing smelly, moldy bread onto a cut, and you'd be right. For centuries, the single method that kept coming back was the mold-covered poultice. Bread or cheese pressed against a wound, wrapped tight, left to do its work. It sounds crude, but it often helped. Why did it work? Mold releases small chemicals that stop nearby bacteria from growing. People didn't know about microbes or molecules, but they saw wounds heal more often when mold was nearby. Those chemicals are the same idea behind antibiotics. Only modern drugs are purified, measured, and tested in labs. Compared to today's antibiotics, medieval poultices were hit or miss. A fresh, lucky mold might slow infection. The next batch might do nothing or introduce other problems. Modern antibiotics are consistent, targeted, and safer, which is why they replaced folk treatments once we understood how germs work. Quick summary of the key points. Doctors used moldy poultices on wounds. Mold helped by making germ-killing chemicals. People relied on observation long before they understood why. Modern antibiotics are a refined, reliable version of that natural trick. If this story surprised you, imagine how many other cures started as simple observations. Think about the last small scrape you healed at home. The leap from that to life-saving drugs began with the same kind of curiosity. If you enjoyed this, like or subscribe and tell us in the comments what historical cure you want to see next. In the next video, we'll follow the accidental path from moldy bread to Alexander Fleming's lab and the discovery that changed medicine forever. The past smelled strange and worked in unexpected ways, and the best part is that history still has more surprises to show us.